Hi, this is Amy again. I serve as a spokesperson for Nehemiah Reset. Today, I wanted to talk to you about the various fraud cases that have been uncovered in Minnesota in recent years. Minnesota has faced significant challenges with fraud in various state and federal programs. These fraudulent activities have not only depleted public funds but also eroded trust in governmental institutions. This comprehensive analysis delves into the specific instances of fraud, the perpetrators, the methods used, and the measures taken by the government to address and prevent such fraud in the future. Minnesota, known for its progressive policies and robust social programs, has been a target for fraudulent activities in recent years. The state's commitment to supporting its residents through various welfare, healthcare, and educational programs has inadvertently provided opportunities for unscrupulous individuals and organizations to exploit these systems. This video explores the fraudulent activities discovered in state and federal programs, the impact on public resources, and the steps taken to mitigate and prevent future occurrences. One area of fraud occurred in the welfare program. This involved the Minnesota Family Investment Program or MFIP. The Minnesota Family Investment Program is a welfare program designed to provide financial assistance to low-income families with children. Recent investigations have uncovered significant fraud within this program. Over the past 2 years, it is estimated that approximately $50 million has been fraudulently obtained through MFIP. The fraud was primarily committed by individuals and small organizations that falsified documents to qualify for benefits. Some cases involved collusion between applicants and program administrators. Common methods included providing false income statements, fabricating residency documents, and submitting fake birth certificates to increase the number of eligible dependents. Minnesota Department of Human Services or DHS has implemented stricter verification processes and increased audits. They have also enhanced training for program administrators to better detect fraudulent applications. Several individuals have been charged with welfare fraud, identity theft, and forgery. Some have received jail sentences, while others have been ordered to repay the fraudulently obtained funds. DHS has introduced an electronic verification system that cross-references applicant information with other state and federal databases. Additionally, they have established a hotline for reporting suspected fraud and increased penalties for those found guilty of welfare fraud. A second area of fraud has been discovered in the healthcare program. This occurred in the area of Medicaid. Medicaid, a joint federal and state program, provides healthcare coverage to low-income individuals and families. Minnesota has seen a surge in Medicaid fraud, particularly in the areas of billing and provider services. Estimates suggest that over $100 million has been fraudulently obtained through Medicaid in the past 2 years. The fraud was committed by a mix of healthcare providers, including doctors, nurses, and administrative staff, as well as patients who provided false information to qualify for benefits. Common tactics included billing for services not rendered, upcoding, billing for more expensive services than those provided, and submitting claims for phantom patients. Some providers also offered kickbacks to patients in exchange for their Medicaid information. The Minnesota Department of Health or MDH has intensified its auditing and investigative efforts. They have also collaborated with the Federal Centers for Medicare and Medicaid Services or CMS to share data and best practices. Numerous healthcare providers have been charged with healthcare fraud, false claims, and conspiracy. Some have faced significant fines and imprisonment. The MDH has implemented a data analytics system to identify unusual billing patterns and potential fraud. They have also increased the frequency of provider audits and enhanced training for staff to recognize red flags. Fraud not only occurred in Medicaid, it also occurred in Medicare. Medicare, primarily a federal program, also experiences fraud in Minnesota, often intertwined with Medicaid fraud due to the overlapping nature of the programs. Approximately $75 million has been identified as fraudulently obtained through Medicare in the past 2 years. Similar to Medicaid, fraud was committed by healthcare providers and patients. Some organized crime groups were also involved in large-scale fraud schemes. Tactics included billing for unnecessary medical equipment, submitting claims for services not provided, and creating fake medical records to justify payments. The U.S. Department of Health and Human Services or HHS Office of Inspector General or OIG has worked closely with state authorities to investigate and prosecute fraud cases. They have also increased public awareness campaigns to educate beneficiaries about potential scams. Several healthcare providers and organized crime members have been charged with healthcare fraud, conspiracy, and money laundering. Some have received lengthy prison sentences and hefty fines. The HHS OIG has enhanced its data analysis capabilities to detect fraudulent patterns and has increased the number of undercover operations to catch perpetrators in the act. They have also improved coordination with state agencies to share intelligence and resources. A third area of fraud has occurred in the educational program in the area of higher education grant and loan programs. Minnesota offers various grants and loan programs to support students pursuing higher education. These programs have also fallen victim to fraudulent activities. It is estimated that over $20 million has been fraudulently obtained through higher education grant and loan programs in the past 2 years. The fraud was primarily committed by students, educational institutions, and administrative staff who colluded to misappropriate funds. Common methods included submitting false financial aid applications, creating fake student identities, and inflating tuition costs to increase loan amounts. The Minnesota Office of Higher Education or OHE has strengthened its oversight and enforcement mechanisms. They have also increased collaboration with federal agencies, such as the Department of Education, to share information and coordinate investigations. Several students and educational institution staff have been charged with fraud, identity theft, and forgery. Some have been ordered to repay the fraudulently obtained funds and face potential imprisonment. The OHE has implemented a more rigorous application and verification process for financial aid. They have also increased monitoring of educational institutions to ensure compliance with federal and state regulations. A fourth area of fraud occurred in the area of Minnesota Unemployment Insurance Program. The Minnesota Unemployment Insurance Program provides temporary financial assistance to workers who have lost their jobs. This program has seen a significant increase in fraudulent claims, particularly during the COVID-19 pandemic. Estimates suggest that over $150 million has been fraudulently obtained through the unemployment insurance program in the past 2 years. The fraud was committed by individuals who submitted false claims, identity thieves who used stolen personal information, and organized crime groups that operated large-scale fraud schemes. Common tactics included submitting claims using stolen identities, providing false employment and income information, and creating fake employer records to qualify for benefits. The Minnesota Department of Employment and Economic Development or DEED has intensified its efforts to detect and prevent fraud. They have implemented advanced data analytics and increased the number of investigations and audits. Numerous individuals have been charged with unemployment insurance fraud, identity theft, and conspiracy. Some have faced significant fines and imprisonment. The DEED has enhanced its verification processes and increased coordination with law enforcement agencies to share intelligence and resources. They have also improved public awareness campaigns to educate potential victims about identity theft and fraud. A fifth area of fraud has occurred in the housing program through the Minnesota Housing Finance Agency or MHFA. The MHFA provides various housing assistance programs, including rental assistance and homeownership initiatives. These programs have also experienced fraudulent activities. It is estimated that over $30 million has been fraudulently obtained through MHFA programs in the past 2 years. The fraud was committed by individuals, landlords, and real estate agents who colluded to misappropriate funds. Common methods included providing false income and residency documents, inflating rental costs, and creating fake lease agreements to qualify for assistance. The MHFA has strengthened its oversight and enforcement mechanisms. They have also increased collaboration with local law enforcement and federal agencies to investigate and prosecute fraud cases. Several individuals, including landlords and real estate agents, have been charged with housing fraud, forgery, and conspiracy. Some have been ordered to repay the fraudulently obtained funds and face potential imprisonment. The MHFA has implemented a more rigorous application and verification process for housing assistance. They have also increased monitoring of landlords and real estate agents to ensure compliance with program regulations. In conclusion, the discovery of widespread fraud in Minnesota's state and federal programs highlights the need for enhanced oversight, stricter verification processes, and increased collaboration between agencies. While significant strides have been made in detecting and prosecuting fraudulent activities, continuous vigilance and adaptive measures are essential to prevent future occurrences. By implementing robust preventive measures and leveraging advanced technologies, Minnesota can better protect its public resources and ensure that assistance programs serve their intended beneficiaries. The question one needs to ask is why this happened. Why have so many fraud occurrences happened in recent years? We suspect that because of COVID-19, many programs were started to respond to this situation and the staff that existed were not capable of handling the new programs properly. We also suspect that the appointments made by Governor Walz did not have sufficient experience and expertise to handle the increased volume of work. Most of the fraud occurred because proper checks and balances were not established for the programs where fraud occurred. We suspect that many of the appointments made by Governor Walz were made using DEI criteria as the principal reason for selecting individuals to head these departments. These individuals probably did not have the proper background to handle their assignments. We will explore the experience of department heads in another video to determine if this had anything to do with the recent fraud that was discovered in these departments. Whatever the cause, it is ridiculous for any of these cases of fraud to go undiscovered for so long. I just hope that the public will look at these cases of fraud, and it would give them second thoughts about voting for the same government officials again. Thanks again for watching this video on fraud in Minnesota. I hope by studying this video you have a clearer understanding of how so much fraud has occurred lately in the state of Minnesota. If you want to see some other videos on this and other important topics, go to our website or our Rumble account. Have a great day.